What does the internal urethral sphincter do for bladder control? Imagine your bladder as a balloon that fills up with urine, and your body needs a way to hold it until the right moment to go. That's where the internal urethral sphincter comes into play. It is a smooth muscle located right at the junction where the bladder connects to the urethra, acting like a gatekeeper for urine. Its main job is to keep urine from leaking out involuntarily, especially when you are not ready to urinate. It does this by staying constantly contracted, which is controlled automatically by your nervous system, specifically the sympathetic nervous system. This means it works without your conscious effort, maintaining continence during the bladder's filling phase. The internal urethral sphincter is made of smooth muscle fibers, which respond to nerve signals from the spinal cord. When your bladder begins to fill, signals from the lower parts of your spinal cord tell the sphincter to stay tight, keeping the urine inside. When the bladder reaches a certain fullness and it's time to go, the parasympathetic nerves send signals to relax the sphincter. This involuntary relaxation allows urine to flow from the bladder into the urethra, making it possible to urinate. At the same time, the detrusor muscle of the bladder contracts to push the urine out, and the external urethral sphincter, which is under voluntary control, also relaxes to let the urine pass. In men, the internal urethral sphincter has an additional role during ejaculation. It contracts to prevent semen from flowing backward into the bladder, which is important for reproductive health. After urination or ejaculation, the sphincter contracts again to close the bladder outlet, helping to maintain continence and prevent any leakage. Proper functioning of this sphincter is vital for bladder health. If it doesn't work properly because of nerve damage or muscle issues, it can lead to problems like urinary incontinence or incomplete emptying of the bladder. These issues are common in certain health conditions and can affect quality of life. Understanding how this muscle works helps us appreciate the complex coordination involved in normal urination, which involves the internal sphincter relaxing, the bladder contracting, and the external sphincter voluntarily relaxing. In summary, the internal urethral sphincter keeps urine in during storage by staying contracted involuntarily. It relaxes automatically when it's time to urinate, allowing urine to flow out. It also plays a role in preventing retrograde ejaculation in men. This muscle works seamlessly with other parts of the urinary system to ensure bladder control and continence. For any concerns about bladder function or health, it's always best to consult a healthcare professional who can provide personalized advice based on individual needs.